Now, I'm looking at the base of this pyramid, and let me go back on this slide. Do you see all the grains there at the bottom, and the fruit and the vegetables? And my thought first goes to, well, if I'm going to be on this diet, will I gain weight? Or will I be able to lose weight on this diet, as a matter of fact? All the calories seem to be there. Well, I'm going to hint back to the slides that I just presented before, that we're talking about what quality of carbohydrates are we going to use. Remember, the concentrated ones, the sugar bombs, are right at the top of the pyramid. And on the other hand, the other ones, the healthier ones, are down here. And to back ourselves, there are studies to show that high healthy carbohydrate and decreased animal fat diets are actually not associated with gain in our weights. And actually, if I look at it further, there is a study that has been published in a very prestigious medical journal, the New England Journal of Medicine, some 2 years ago. And it shows that it compared 3 different types of diets, and it showed that the Mediterranean type of a diet with reduced calories here, they recommended women to have less than 1,500 calories per day and men to have less than 1,800 calories per day, but respecting the principles of Mediterranean type of a diet. When they used this diet was at 2 years was just as efficient as the high protein, or also notoriously known the high protein diet or the low carbohydrate diet nowadays. Both of them have been actually better than the low lipid diets. My personal take out of everything that I've read is it comes down to portions. How big is your portion? What can you do to reduce your portions? Okay, now I'm going to come back and further talk about the Mediterranean types of a diet. Well, all said and good, all sorts of hypotheses, it will work, it will not work. Well, here is the evidence. Reductions, Mediterranean-based or Mediterranean types of diets have been shown to reduce overall mortality, mortality from cardiovascular disease, incidence in mortality from cancer, incidence of Parkinson's disease, incidence of Alzheimer's disease. So it's not just like, oh, we changed this one piece of lab. For instance, we just improved the cholesterol, or we just did this. It is much more than that. We improved outcomes, hard outcomes. For instance, a study that I just quoted earlier on had showed that in patients with an established coronary artery disease who had a myocardial infarction, if the patients who are randomized, who are subjected to a diet of Mediterranean type, as opposed to patients who are subjected to a regular recommendations, a prudent cardiac diet, significant and dramatic changes in mortality mortality and myocardial infarctions have occurred. So look into this. It gets to be approximately 70% reduction at 4 years. Highly statistically significant in patients who did this diet, and more importantly, who adhered to this diet. It is important to state that once you start this diet, we many times see in medicine changes or therapy options that we only see outcomes in terms of cardiovascular death or so at the end of, say, 1 year or 2 years. The changes, if you look at the survival curves in patients who have been studied here, and I'm just giving you this trial as a prototype of a Mediterranean type of a diet. It is a randomized controlled trial. There are several other ones that prove the same. If you look at the survival curves, the curves start splitting early, so difference in survival starts happen early. I'm putting this slide on to increase the awareness of the importance of implementing a diet based on Mediterranean types of foods, more so in patients with cardiovascular disease, but not only. On this left side of this slide, I'm presenting a medication which is extremely important in what we cardiologists do nowadays. It's simvastatin. Medications out of statin groups have revolutionized what we do nowadays. Tremendous outcomes. We do see decrease in cardiovascular mortality nowadays. We do see decreased numbers of patients coming to the cath lab or needing stentings or bypass surgery. And one of the reasons that this happens is probably an accumulative effect over time of medications such as statins. A landmark trial which I want to present here has been made on patients who have coronary artery disease. Many of them have had a heart attack in past. At 5.4 years, there has been a 42% reduction in cardiovascular death. Landmark trial. On the other side of the slide, I will present one of the Mediterranean diets, which is also a randomized controlled study. And at 4 years, the reduction in the same endpoint has come up to 65%. Now, I don't want this to be misunderstood. From a statistical and pure scientific point of view, it is wrong to compare directly these two different types of interventions. So it is wrong to draw the wrong conclusions out of this. But look how strong and what a strong signal just a simple measure such as a diet really sends out. Now, what we do in practice, and this depends on patient's risk profile, on cholesterol values, these two types of diets are actually, we use them daily as a synergistic approach, both of them combined together. Again, depending on need and background of particular patients. Now, a word about hypertensive patients. One of the diets which is recommended to help our patients decrease their blood pressures and maybe reduce the amounts of medications that they would use, and actually the first step that is implemented is a healthy lifestyle that should decrease blood pressures. And one of the representatives that I'm calling here is the DASH diet that has been proven and does show improvement in blood pressures just by implementing this diet. If I'm looking at how this diet is made, it is very close to what the Mediterranean type of a diet has to say and has to recommend. Furthermore, the authors have gone into saying, well, what if I also reduce the salt in my hypertensive patients and recommend this diet? And that has shown further improvements in blood pressure values. So a diet which comes close to a Mediterranean type of a diet, together with a decreased use of salt, to 1.5 grams per day in this particular study, has significantly decreased blood pressure values. Now, if I'm talking about salt, let me go further and inform the audience that you know, the U.S. Department of Agriculture has very recently issued a document. It is a document that has been reissued over time, and it calls for the general population to limit their use of sodium to approximately 2.5 grams per day. But if you are 51 years or older, if you are African American, if you are hypertensive, if you are diabetic, or if you have a chronic kidney failure, then the recommendation goes to less than 1.5 grams per day. So this is a big society recommendations. Obviously, needless to say that patients who have a heart failure, who tend to accumulate waters and form swelling of their legs and shortness of breath, the salt should be restricted in these patients. I'm enumerating here, this is a busy slide, and I have another one even busier. There are several sources of salt that we use. Sometimes we forget about these salt. It doesn't have to be free salt. We obviously should not add salt to our foods. But you know, several constituents in the food that we like to cook nowadays are enumerated here, including, say, seasoned salts and meat tenderizer, or all sorts of sauce that make our food tastier. This slide, I apologize for the length and the busy slide. Whoever can read it should absolutely read it, more so our patients who are at risk here. Other sources of salt are typically the canned food, the processed foods, the famous chips, and nuts. I did recommend nuts, but not salty nuts. In regards to this, to everything that I said here in diet, there's all sorts of things. Our science is not perfect. I would not go with one particular constituent and just use that solely one recommendation. I think it has to be a combination of all of these, and more of all, I recommend moderation in everything that one would do, and this is how I always counsel my patient. Go for moderation, apply these principles as guideline principles of how we can change your food to try to get healthier and reduce, improve your cholesterol and reduce cardiovascular outcomes.